Today we're going to talk about 360 breathing. This is such a passion of mine because it is so important for you to understand 360 breathing to help you support your core recovery and all your exercises going forward. It literally has made such a difference in how my core feels, moves, supports, and even looks that it's honestly irritating to me. It's not taught as a regular basis. And so the thing about 360 breathing versus what you see online is 360 breathing involves your rib cage. Your lungs are located in your ribs. And so as you breathe, your ribs are expected to move and relax. When you see the videos of the big dramatic belly breathing, yes, that's a great visual, but you see the ribs aren't really moving. It's just you pushing your belly and pressure out. That is the biggest thing about 360 breathing, is that it's not just teaching you how to breathe, it's how to manage pressure in this portion of your body. If you have too much pressure going down, like going downwards, especially after being postpartum, that puts more pressure on your pelvic floor and more pressure outward. It also makes it really hard for your upper body to support any weight, whether that's lifting or carrying kids on a regular basis. And so pressure management is life-changing. So 360 breathing is a dynamic movement that involves your rib cage, your transverse abdominis, which is the core, because your core has your deep muscles and your rectus abdominis. These muscles right here are your six-pack abs, and we're looking to go a little bit deeper into that to help support your whole core. They actually kind of wrap around like this, and it also supports your pelvic floor. This all, and your diaphragm up here, these all work together. And I know that sounds a little overwhelming, but we will piece it together. And so eventually this isn't something that you have to think so much about. It's something that you're gonna practice, and then it becomes more second nature to you. So when you go to do a lift or anything, you know how to properly brace for that lift and move forward without having to think about it too much. The first step in understanding 360 breathing is understanding how to get your ribs to move as well. Okay, so the ribs are supposed to move forward, to the sides, and to the back. And getting your ribs to move towards the back is often what moms struggle with the most. And overall, you take a big deep breath in, expand all directions. Sometimes putting your hands right here in your ribs can be helpful for you to feel your ribs expand and fill that gap in your hands and push it all out. And then you lift from your pelvic floor, release your lower core here as you exhale. And you want to close your ribs, but we don't want to push down, because when we drop the ribs is when we start putting more pressure downwards. And this is often what C-section moms struggle with the most, because we can't feel, especially in the beginning, we have a hard time feeling connecting to this lower core. And that's why trying to do the scalar massage and do nerve desensitization and different movements to reconnect to that lower core can make such a huge difference in managing pressure in your lower core again, especially mastering 360 breathing. First, I want to get started in some movements to help you understand how to expand into your ribs, especially if you're newly postpartum. And so you can use a block, kind of support yourself like this, or even a towel can work. Sometimes a towel is a little bit easier. The reason it's better to try to do it on your side a little bit is because it allows your back to expand a little bit more. We're going to go through some movements to help you really learn how to master 360 breathing. So this would be the first one, laying on your side. You can do a light pillow. Deep breath in, lift from here. And your shoulders should stay still. If they're moving around too much, then you're likely moving your body around. You want your hips in line with your ribs. Deep breath in and exhale. And as you exhale, you want to exhale until you feel the air, until you feel these side muscles right here, these are and all around engaged. Usually I think a lot of moms end up stopping a little too early in their exhale because they think that they did it all because they can feel it here. But the exhale, it'll bulge out a little bit more at the sides when that happens. Okay, so another move to help you feel your back expanding is either a ball, a pillow, or something and kind of holding contact here, or a block. And then as you see, my back is rounded. And then as you take a big deep breath in. So air in your ribs can move in the path of least resistance. So when you're bent forward like this, as you breathe in, it's easiest for your back ribs to expand and contract versus going against the block. So this is why this is a really, really good one if you're struggling to feel that expansion in your back. Do it again. Okay. And then the last one I want to show you is, I mean, there's definitely more that we can do, but last one is to take a resistance band, if you have one, and actually wrap it around your chest like this and pull it a little bit tight, so then it gives you some like touchback feedback as far as your ribs moving, because these movements are not as obvious and dramatic as they look online. So sometimes it's more about what you can feel than what you can visibly see. Okay, take a deep breath in. I hope that helps, and I can't wait for you to master 360 breathing.